So my name is Angela Loyse. I'm an associate professor at City St George's, um, and I work in implementation science, clinical trials, and advocacy, mainly in Africa. And I'm really passionate about locally led health system strengthening. It's the DREAM project, which is an implementation science project that aim to reduce mortality from HIV-related central nervous system infection, which is a leading cause of HIV-related deaths. So approximately about a third of deaths are due to central nervous system infections, so infections of the brain or the coverings of the brain. So the aim was to translate the results of clinical trials into routine care settings. So we knew that there was a big gap between outcomes from meningitis linked HIV in trials and resource limited settings and what was happening in routine care. So the aim, as said, was to reduce mortality, to describe the epidemiology, and there were three phases. So the project took place in 5 public hospitals in Malawi, Tanzania, and Cameroon. So we're talking tertiary and secondary level hospitals. And during the observation phase, so we had an observation, training, and implementation phase. So it was a before and after design, comparing mortality between the implementation and the observation phases. So the aim was to obviously reduce mortality, and we developed implementation interventions and strategies iteratively during the observation and training phases of the project. So we used in many ways the hospital ecosystem, the frontline healthcare workers, the laboratory technicians, and their leaders were the ones that co-designed these strategies and interventions iteratively during the whole process. So very much in the end, it was a bottom-up approach. The implementation strategies were twofold. These were to empower the local leadership and teams to design the interventions themselves.